look at that or review that at all?
Yeah, our team has taken a look at that. We, again, have set out on our own course that we think is working. Some of them were replicated within the report, but we're always looking for new information. And again, one size doesn't fit all, as we've found out, and there are always new opportunities to do something better. So we're still looking at the report, determining if there's anything that we can use to make better use of our system.
Yeah, some of the recommendations are kind of common sense principles that do apply across the board. I mean, increasing access to substance abuse treatment programs. We're going to hear further testimony today on that. Also, under federal law, insurers are already required to cover addiction treatment and mental health services. Many of them aren't, and many of them aren't including them within their networks, and especially difficult in rural areas given what's available out there. They also recommended dedicating more money for treatment overall. They were encouraging greater use of alternative and complementary forms of medicine rather than just a cocktail of prescription drugs that often lead to addiction and then contributing to the opioid epidemic. One of the recommendations, I'm wondering if you had a chance to look at it or have an opinion, is recommending that we give the Department of Labor the authority to start penalizing insurance companies that aren't including it in the network and are not adequately providing coverage for addiction treatment or other mental health services. Is that something we ought to be considering?
So what I would say is that while they were holding their meetings and writing their report, our Opioid Coordination Council, which I chaired, we were writing a report as well, and we came out almost the same on so many issues. It was, really came out right at the same time. And the NGA also has a report that's, there's a lot of common sense in all the documents, so I agree with your points. The last question that you asked, I think that we have to embrace this as a chronic condition. And then if we do, we should make Medicare, Medicaid, and commercial insurers treat this as an essential health benefit like we would kidney disease or some other diabetes or some other chronic condition. So yes, I would think that would be.
The other thing I think we ought to be considering is, since you guys are out front doing a lot of good work and trying to get out, and virtually every state is trying to do the same thing, is some type of national repository of best practices and best evidence medicine, what's working and what isn't, so each state isn't required to recreate the same wheel over again. And interesting, even though we've been going through problems with VA reform lately, we've had some success in a bipartisan fashion implementing certain reforms with the VA Medical Center, especially when it comes to pain management and drug addiction. In fact, in my home area, Tomah, Wisconsin, the VA Center is developing a really interesting model with a tremendous track record of proven results that could become a model of care throughout the country if we do it right. So I would also take a closer look at what the VA's been doing on this front for some time. Thank you, Mr. Chairman.
Secretary Gomez, hold that thought and kind of weave your answer into an inquiry that's coming from Ms. Jenkins from Kansas.
Thank you, Mr. Chairman, and thank you, Governor, for being with us in this subcommittee. Like Vermont, my home state of Kansas is struggling with a nationwide opioid epidemic. In my view, it's particularly difficult for rural states to expand access to opioid treatment services just because of a lack of treatment